I'm Dr. Hansa Bhargava, Senior Medical Director for WebMD, and welcome to the special program, The Doctor's Dilemma of Overcoming Burnout. In our Medscape Burnout report, we found that 51% of women and 43% of male doctors were experiencing some symptoms of stress and burnout. How are doctors coping, and what are possible solutions to this growing problem amongst healthcare workers? Although hospitals are acknowledging this issue and looking into possible solutions, what can we do at ground zero to help ourselves? There is now growing evidence that techniques such as CBCT, CRM, and compassion can make a real difference to us. We will talk to experts and present tools and possible solutions that research is showing can make a difference. Fatigue, stress, and burnout is a real issue in day-to-day practice. Joining me for this episode is Dr. Linda Graby, Clinical Assistant Professor at the Woodruff School of Nursing with Emory University and teacher of a technique to help burnout, the community resiliency model. She and her team have used this for veterans, people who have addiction disorders, and nurses who have experienced stress and trauma in their jobs. Thank you so much for joining us today, Linda.
I'm very pleased to be here. Thank you.
Linda, stress and burnout is almost an epidemic amongst our healthcare workers. What do you think are some of the symptoms that we've seen?
Well, stress and burnout were a problem before the pandemic. We know that. 50% of doctors and nurses across the country are suffering from burnout, and this means they may leave their work. They may prematurely leave their professions or not do a very good job because they're suffering. With the pandemic, definitely stress has increased, and we are expecting a second epidemic of mental health problems in the general public, but particularly in frontline providers.
I was really excited to read about some of the work that you've been doing using the CRM or community resiliency model.
It's the community resiliency model, which comes from the Trauma Resource Institute in California. These are folks who were psychotherapists who responded to international disasters. So the earthquakes in China and Haiti, the tsunami, hurricanes Katrina, and in the Philippines as well. So there was not time to do actual psychotherapy, certainly not cognitive behavior thanerapies, but body-based psychotherapists who were able to teach trauma survivors some pretty simple self-regulation skills so that they felt a sense of control, and they also learned that they could feel good again after terrible losses of home and families. So this evolved into the community resiliency model, which is a self-care model. So it fits really beautifully for healthcare providers and really the general community too. It's an elegantly simple model of body awareness. It's also called interoception, which is simply noticing sensations in the body, learning the difference between sensations of distress and sensations of well-being, and knowing how to differentiate between pleasant, neutral, and unpleasant sensations. And you can teach it fairly quickly to somebody.
Great. Now, you showed me a graph when we spoke, and it was very interesting. It almost looks like an arrhythmia or, a heart rhythm where you have a shock to the system, and then you push it back in. Can you explain that graph to us?
Sure. CRM really hinges on an awareness of the autonomic nervous system, but also uses the autonomic nervous system to get the body and mind back into synchrony or a more regulated state. So if I am anxious, I might notice some tension across my shoulders, but then I can use CRM skills such as noticing the sensation of the floor under my feet, or even something simple like noticing the texture of my sweater. And that's going to put me into a parasympathetic state of restoration.
So you're saying, like, on the ground, a nurse running around, a doctor in a code situation, an EMT who's dealing with a really stressful situation, could actually use this technique while they're there to help the parasympathetic system balance the flight or fight response that's happening?
Exactly. So, for example, a first responder could notice before going into a home where there's perhaps some domestic violence going on. It's a dangerous situation for the inhabitants and for the law enforcement officers or paramedics. You know, you might just for one split second notice the temperature of the doorknob, or pay attention to sounds or other sensations.
I'm particularly interested in how you said that these nurses who went through the program actually had impact even a year after they did the program.
Right. So the idea of CRIM is that we all have a resilient zone. This is sort of this internal state where we are maybe at our best selves, perhaps not, but we can function. So we're still interacting with people, solving problems, and so on. But things happen that are overcome our nervous system so that we get thrust out of the zone and into either a hyper aroused state where there's too much of the nervous system's accelerator, sympathetic discharge, or too much of the parasympathetic, which is sort of like the brakes of the nervous system. And when we did the study of 77 nurses, a randomized controlled trial, we found that 1 year later, the nurses were still using these skills, CRIM skills of tracking and grounding in sort of dire clinical situations with patients, codes even. But nobody would know that they were noticing the fabric of their scrubs or the sensation of the bed rail, for example, in a code. But it would help to bring down their heart rate and their blood pressure right there. So these are very powerful but simple techniques.
So let me ask you, just getting into pragmatics here, Linda, if our doctors, nurses, healthcare workers who are listening would like to do this, where could they find this course and how long is it? What is it exactly and how can they do it?
Well, they can access a free introduction to CRIM, which is just along at the Emory Nursing Experience platform. There's a free 1 hour recording that I made with a colleague, and that's a beginning, but they should go to the Trauma Resource Institute website because there are constantly programs that they could join, and I recommend it highly.
One final question for you, Linda. If there are people who are watching this who are suffering from anxiety or depression, stress, and we certainly have a lot to be stressed out about with COVID-19 and some of the effects of that, can they access this course to learn about interoception as well?
Yes, and there's also a free app called iChill. So they can download that. That only takes about 15 to 20 minutes, but they'll come away with some skills they can use. And then alternatively, they could listen to a recording that I helped make at the Emory Nursing Experience platform. That's free. It's called Cultivating Our Best Selves During COVID.
Wonderful. Linda, I am so grateful that you've spent some time with us. Some really, really interesting and impactful points here. Thank you so much. Is there anything else you'd like to add as we close this interview out?
Well, I do want to point out that the nurses had a moderate to large effect size for improved well-being resiliency and reduced secondary traumatic stress and physical symptoms 1 year after their 3-hour training. So it was a one-time thing.
So a one-time 3-hour workshop leading to at least a year of impact. Well, thank you again, Dr. Linda Graby here. And she, again, is at Emory School of Nursing. She's a professor there and has done some great work. Thank you again, Linda, for being here.
Well, thank you so much. This was wonderful.
Thanks for watching this first episode on physician burnout, and be sure to watch our next episode. That will feature a fascinating conversation with Professor Lobsang Tenzin Negi, Executive Director of the Compassion Center at Emory University. A former monk from Tibet, Dr. Negi came here to study contemplative sciences and their effects on stress. He's done research and teaching on the CBCT techniques that have been proven to decrease cortisol and other inflammatory markers and reduce stress. Join us for this next episode to learn about this. See you then.